Okay, we're going to talk about how to put in a Bakri balloon. The provider is actually going to be placing the Bakri balloon, but as the RN, we're going to help gather the supplies, put everything together, and help fill the balloon for them. So we need the Bakri balloon itself. You need the Foley catheter bag just by itself. This comes in packaging that looks just like the Foley kit, but just the bag itself, which I've already opened this one, but you're going to grab that. And you're going to have your 500cc bag of normal saline. So we're going to educate our patient. The doctor is probably going to do the majority of that because this is going to be post-delivery. The physician's still going to be there when they want to place this in for a mom who is having a postpartum hemorrhage. And so they are going to have mom probably already up in stirrups, ready to go. As the nurse, we are going to help them put this together. So we're going to open our Bakri balloon. It comes in a kit that looks like this. We're going to take the top piece off. This is our tubing. Then we have our syringe, the actual Bakri balloon itself, and our stopcock. So first thing we're going to do is we are going to spike our bag of fluid. And these just snap right here. You're going to unsnap these to get your tubing out. So we're going to spike our bag of fluid, and we're going to prime this tubing. And there's no clamp on it, so you actually have to just clamp it. Then we're going to take our stopcock, and it goes, you can see this red on this stopcock right here. This is red, red to red. Then we're going to take our syringe, and this will only go on one side, so we're going to put our syringe on one side. And then we're going to take our Bakri balloon, and this has an additional stopcock. This is going to go on the other side. When you get your Bakri balloon out of your packaging, your blue stopcock is going to be straight up and down. You do not need to worry about turning that at any point until we're completely done filling the balloon. So leave it just like this. Now the provider is going to take the Bakri balloon itself. They're going to have their gloves on. They're going to be ready to go. They're going to lube this up. They're going to have some ask you for some ring forceps. And they're going to take the ring forceps and they are going to place this Bakri balloon in the uterus. I'm going to take this mannequin's belly off so you can kind of see. So they're going to place this to where it's up inside the uterus. Now we're going to take our Foley bag and we are going to connect it right here to the Bakri balloon for our drainage output. You can hang this down.
This part all again so they can see the whole connection.
Yeah, so this piece right here from your Foley bag connects right here. You just push that on as such. Okay. Now the provider's gonna say, okay, we're ready to go. Well, let's fill it. This is a 50 ml syringe. So we're gonna put in 50 at a time. And all you have to do is you pull. You get your 50. And then you push. No turning of any stopcock. It is a one-way valve. Pull, push, pull, push. So we're going to put that first 50 in. The provider's going to say, yep, we need to go more. Keep going. You're going to pull your second 50. And you can max fill this balloon to 500 cc's. The provider's going to tell you, okay, second 50 in. So now we're at 100. Provider says, nope, we still need more. Keep going. Pull up another 50. Push your next 50 in. Now we're at 150. Provider says, nope, still need more. All right, we're pulling back another 50. Okay. We just want to make sure we just keep track of how much we've put in, that we keep telling our provider. Okay. Now 200 is in. Okay, and then you can continue to do that until your provider says that it is where they need it to be. It's secured in the uterus and it is tamponading any of that bleeding. So once they tell you you're done, now what we want to do is now we're going to actually adjust this stopcock. We are going to turn this stopcock to off, and now we're going to disconnect from right here. You want to leave that stopcock attached. You're going to just disconnect the red stopcock with your syringe. Okay. Now the provider is going to pack the vagina to keep that Bakri balloon in place. They're going to use either Curlex or 4x4s. So they're going to place that packing into the vagina to hold that Bakri balloon in place where it needs to go. Us as nursing providers, we are going to use a butterfly tegaderm, and we are going to secure this to the side of the leg. And what we want to do is when we secure this, just like we would a Foley catheter, we want to write on that securement, on that tegaderm or on that butterfly securement device, we want to write date, time, initials, the amount of fluid that's in that Bakri balloon, and the amount of vaginal packing that's in there, whether that be Curlex times 1, Curlex times 2, 4x4s times 8. Whatever's in there, we want to write that on our securement device as well. It's a quick, easy visual of what is inside when it was done, because we have to take this out within 24 hours. It can stay in place for up to 24 hours, but your provider is going to let you know when to start taking it out. So once we've secured that to the leg, we've documented everything on our securement, then we can actually document in Beacon. We want to document all of those same things. Who placed it, when it was placed, how much fluid is in, what vaginal packing has been used, and how the patient tolerated. Once we have an order to take it out, most of your providers are going to tell you to take out 50 cc's every 30 minutes. Let them know if you notice any bleeding and what it looks like. So once that happens, we can come back in. We're going to have our 50 cc syringe. You can use any 50 cc syringe. If you put in a Bakri, you can keep the 50 cc syringe that comes with your Bakri balloon if you want to. If it gets tossed, that's okay. Just go grab a new 50 cc syringe, okay? So we're going to come back in the room, and we're going to take out 30 at a time. So we're just going to attach that directly to the stopcock. We're going to open it, and we're going to pull out our first 50. Once we get our 50, we're going to turn that stopcock back off. Take it off, get rid of that 50, wait our 30 minutes if that's what the provider has ordered. Let them know how the bleeding looks, how mom's tolerated. 30 minutes later, if they want us to take out another 50, we'll come back in and continue to do that process per provider order until the Bakri balloon is completely emptied. Once we know we've got all 200, because we put 200 in, once we know we've got all that 200 out that we put in, or 250, 300, however much that provider put in, once we know we've got all of that out, first thing we're going to take out is that vaginal packing. We want to make sure that everything that we put in that's marked on their securement device, that we get all of that out. Once we know that's out, then we're just going to pull straight out, which I actually need to get this the rest of the way out. Let me continue to take our fluid out, and I'll show you to remove. The other thing we want to make sure to do is anything that has drained, any blood that has drained into our Foley bag, that we measure that and add to our QBL, because we're going to be doing QBL on all of our postpartum hemorrhage patients. And then when we take out our vaginal packing, whatever that is, we also want to make sure and weigh our vaginal packing and do our calculations to ensure that we add what the amount of blood that's been soaked on that vaginal packing to our QBL. Okay, so 150 out, we've got 50 more to take out. And as I said, you're going to be doing this about every 30 minutes, taking out 50 at a time. And you'll know too when you get to the bottom of that 50, because it starts to get really hard to pull. I always put it on one more time after that last one, just to make sure I don't get any residual. And now we're just going to tell mom, take a big deep breath, and you're just going to pull straight out just like you would a Foley catheter. This would not be this difficult in real life. This mannequin is holding on. Sorry, normally, like I said, this would not be, in real life, this would not be this hard. This mannequin is holding on. Once you've gotten it out, you're just going to completely toss everything into the trash, dispose of it as necessary.